Okay, let's talk about something everybody does, but nobody admits to. Picking your nose. Yep, we're going there today. Now before you click away, hear me out. Because what happens inside your nose when you stop clearing it out is actually pretty fascinating. And more importantly, there's a right way and a very wrong way to handle what builds up in there. So stick around, because by the end of this video, you'll never think about your nose the same way again. How dried mucus forms. Let's start with the basics. Your nose is constantly producing mucus, and that's actually a good thing. Mucus is your body's built-in air filter. It traps dust, allergens, bacteria, viruses, and other airborne particles before they can travel deeper into your respiratory system. Think of it as the bouncer at the door of your lungs. Now, your nose produces roughly 1 to 2 quarts of mucus every single day. Most of it flows down the back of your throat without you even noticing. But some of it, along with all those trapped particles, sits near the front of your nasal passages and is exposed to the air flowing in and out with every breath. That airflow gradually dries it out. As the moisture evaporates, the mucus thickens, hardens, and crusts, forming what most of us casually call a booger. Scientifically, it's referred to as nasal mucus crust, and it's essentially a compact little archive of everything your nose caught that day. What happens if you don't remove it? So what happens if you just leave it there? More than you might expect. When dried mucus builds up near the front of your nasal passages, it begins to narrow the airway. This means air has a harder time flowing freely in and out. You may notice you feel slightly more congested, start breathing more through your mouth, or even snore more at night, all because of accumulated crust blocking the path. Beyond airflow, that buildup creates another problem. The trapped bacteria and debris packed inside the hardened mucus don't just sit there quietly. They can become a breeding ground for germs. And when that crusty buildup cracks or irritates the delicate nasal lining, it can cause small cuts or bleeding, creating a direct entry point for those bacteria into your system. There's also a comfort issue. Excessive buildup can cause a persistent, itchy, dry sensation inside the nose, which, ironically, is what drives most people to pick in the first place. Left unaddressed, dried crust can also interfere with your sense of smell temporarily, since it blocks odor particles from reaching the smell receptors higher up in your nasal cavity. So yes, regular, proper removal of nasal crust is genuinely important for your comfort, your breathing, and your overall nasal health. Why you should not use your bare fingers. Now here's where things get a little cringeworthy. The most common way people deal with this? Bare fingers. And unfortunately, that's one of the worst things you can do. Your hands, even after washing, carry a significant amount of bacteria. Your fingernails are even worse, harboring germs in the space underneath them. When you insert a bare finger into your nose, you're essentially introducing all of that bacteria directly into a warm, moist environment that's perfectly designed to let things grow. Studies have actually linked frequent bare finger nose picking to an increased risk of Staphylococcus aureus. On top of that, the skin inside your nose is incredibly thin and sensitive. A fingernail can easily cause a small tear, and that tiny wound becomes an open door for infection. The right way to remove nasal crust. So what's the right way to clean out your nose? Here are the best hygiene-approved methods. Saline nasal rinse or spray. This is the gold standard. A simple saline nasal spray, available at any drugstore, moistens and loosens dried mucus, so it drains or can be gently blown out. Using one daily, especially in dry or cold weather, keeps buildup from forming in the first place. Blow your nose properly. Use a soft tissue and blow gently, one nostril at a time. Blowing too hard can push mucus toward the sinuses or ears, causing pressure and discomfort. Gentle, controlled blowing is the safest way to clear your nasal passages. Use a tissue-wrapped finger or cotton swab, carefully. If something stubborn is near the very front of your nostril, wrap a tissue around your finger first, or use a cotton swab moistened with a tiny drop of saline. Go slowly. Stay near the entrance of the nostril only and never dig deep. A nasal aspirator. These are soft bulb-style devices that use gentle suction to pull out mucus, commonly used for infants, but just as effective for adults dealing with thick buildup. So keep it clear, keep it clean, and please, put the fingers down. A saline spray is your new best friend. If this video gave you something to think about, drop a like, hit subscribe, and share this with someone who definitely needs to see it. I'll catch you in the next one. Breathe easy.